May 12th, 2020 for the Lane County Budget Committee to order. And the first item on the list is committee business. Are there any updates from budget staff?
Good afternoon. There are not any updates other than you would have received an email today with some materials, including answers to questions that went out probably at about 10 after 2. So if you didn't have a chance to see that, those are questions that have been answered so far. And you do have some minutes to approve. So that would be all of our updates right now.
Great. One question, Christina, on the agenda for today, it says approval of the committee minutes for May 5th. I believe those have already been approved, right? Correct. We're working on May 7th.
Correct. Yes, you are correct. That's a correction.
Okay. And then as one administrative note, I think I saw Chris Hazen connect. Chris, are you online?
Yes, I am.
Very good. Thank you. Okay. Are there any questions or recommendations for changes to the minutes for the committee meeting for May 7th? Yes, Commissioner Buckley.
I don't necessarily have any changes. It's just that if this has gone out at 10 a.m. and we were in a board meeting, I haven't even had much of a chance to read them. I'm hoping that we would be able to get our meetings, some information a little sooner than right before our meeting begins on the same day. It would be nice to get them like the day before, if possible.
We can try. This is budget staff preparing these. We don't have an outside contractor doing it. So we'll do them as quickly as we can, and maybe we can push them to the next meeting for approval.
So, yes, go ahead.
Hi, Mr. Chair and committee members. I don't have a problem with the timing on the minutes. I mean, you're doing them as soon as you can, but I think it would be good to just push it over to the next meeting so that there's at least a meeting in between the time that the minutes come out as proposed. So maybe putting them on tomorrow's schedule.
Very good. Thank you, Commissioner Sorensen. There's not a motion right now, so unless there's an objection, we'll just go ahead and move those minutes forward to tomorrow's meeting. Seeing no objections, we'll make that happen. So, Christine, if you'll add that to the minutes or the agenda for tomorrow, please.
Mr. Chair?
Yes, Ms. Burney.
The realities for me are that if I don't get something 24 hours in advance, I won't be prepared to do any action upon it. I understand staff is overwhelmed. So I have no issue with the timing either, but I just think we ought to have some sort of rule like that so that we just don't take action on anything that we have not had the opportunity to review as a standard rule moving forward.
I think that if somebody wants to make a motion in that, we can take that up. I do think there may be circumstances where we need to take action on something with less than 24 hours notice. That's my personal feeling, but if somebody wants to make a motion, we'll discuss it further.
You'd hate Eugene City Council.
I would never run for Eugene City Council.
Okay, seeing that who was speaking up there?
Sorry, yeah, this is Chris Hayes, and I'd motion in support of Joe's proposal that with exceptions, that documents be provided with 24 hours notice to review before action is expected. I mean, I think to your point, there may be exceptions to that. If I could just add one other quick comment with your permission, Chair.
Yes, please go ahead.
So I wanted to just acknowledge and recognize the hard work that staff is putting into all of the budget process this month. And And recognize that I've been a source of some of that work as a new member of the Budget Committee. I'm asking lots of questions. And I just want to, for everybody's benefit on this call, to emphasize, because you all can see the questions I'm asking. What I'm really interested in being able to do with my small contribution to this process is be able to communicate back to my fellow citizens what are the metrics that matter in our county, and how is our tax contribution, how are our taxes being utilized to move those metrics in the direction that we all agree is important. The strategic plan, has been the result of a lot of input getting us to where we are now with that, and there are some parts of that strategic plan that very clearly have metrics associated with them. And I think I would motion that it's appropriate for the departments to report on progress against the metrics in the strategic plan at minimum, with the addition of there may be other metrics which are potentially relevant to that strategic plan that the departments may have also developed. That's all when I'm asking metrics questions, that's all I'm asking for. So, it shouldn't, I wouldn't expect, I would hope that it would be no more than, a handful of numbers per element in the strategic plan or per department or what have you. I mean, I think it's ways to understand the impact that our government is having on metrics that matter to our people. That's the essence of where I'm coming from. So, Chair, apologize for that digression, but I do motion in support of Commissioner Burney's proposal as well.
Very good. To restate it, Mr. Hazen has made a motion to, as a procedure for this committee, to receive materials 24 hours in advance of being expected to take action, with exceptions. Is there a second to the motion?
Second.
Commissioner Burney seconded. Any further discussion on the motion?
Herb?
Yes, go ahead, Pete.
Well, first of all, thanks, Chris, for this motion, and thanks, Joe, for the second. I think this is a good general rule, and I think the phrase "with exceptions," which the committee can undertake if there's a need, a timing need that couldn't be avoided. But I think it's a good idea, and I do think it's reasonable that we have the time to look at it, and it's not meant as a criticism at all for the great work that staff is doing on this budget. Thanks.
Great, thank you. Any other discussion? Seeing none, we'll vote. All those in favor of Chris's motion, please say aye.
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 Hi.
All those opposed? Motion passes.
On Chris's motion of my motion, thank you, Chris.
You're most humbly welcome, Commissioner Burney.
Are there any other committee topics to go under the committee business heading? Okay, seeing none, we'll move forward into section 3, Health and Human Services. Ms. Gaffney, again, please.
Good afternoon, Mr. Chair, committee members. We, as a team, are going to work really hard to bring our presentation in at less than the 60-minute allotment so that we can maximize time for questions and conversation with the committee. So you can hold us accountable for that today. And today we're going to discuss the 8 remaining divisions of Health and Human Services that we didn't have an opportunity to discuss with you last week. And again, rather than asking all of our team to introduce themselves, I just want to let you know who's around the table for our discussion today, and you'll get to hear from them directly when we get to their division. We have with us today Kachina Inman, our Assistant Director, Sean Waite, our Administration and Finance Manager, Lisa Willis, who manages our Clinical Financial Services Division, Ron Jelm, who's the manager of our community health centers, Carla Tazamel, who manages our developmental disabilities program, Steve Manila, our human services manager, Lisa Roth, manager of our lane care division, Jocelyn Warren, our public health manager, and Lisa Nichols, our quality and compliance manager. And the rest of our leadership team is here for moral support and any questions that you might have that cross over into their areas. So it's a reminder that Star Felty from Youth Services, Pauline Martin from Behavioral Health, and Dr. Pat Ledke, our senior health officer. Again, we're going to do our very best to tell you the story of Health and Human Services within a very limited period of time, and I look forward to our conversation. So in front of you today is the department structure overview. Again, those are the 8 divisions that we'll talk about today are the ones who are highlighted. And again, as I mentioned last week, our focus is really how do we best leverage the strengths of all of those divisions in order to improve the lives of people in Lane County. The work that we do is critical for both individuals, particularly those who are most vulnerable in our community, and really important for the overall community as well. As you hear more about our public health work and our human services division work, I think you'll see that come through pretty clearly. I'm going to move through these first slides pretty quickly because much of this we covered last Tuesday. Can you go to the next slide, please? So our budget, again, the total operating budget in Health and Human Services is $137.7 million with about 700 FTE in the department. About $12.5 million of our budget, it comes from the general fund, which is about 11% of our operating budget. And the 5 divisions that share that general fund are listed there on the slide. Today we'll talk about human services, our admin section, which includes the strategic resource development, and our public health division. Our largest source of revenue, if you look at the pie over there to the right, I know it's hard to read the numbers, but our largest source of revenue is state money at 45 million and federal at 36 million. And as we started to talk last week, and you'll hear more today, we're headed into some unknown territory with some of those revenue sources as we move forward into next year. What we'll describe for you today is what we know to the best of our ability, and we expect that we're going to come back with adjustments as we get more information. Can you go to the next slide, please? COVID has dropped into our world and has impacted many things, including our budget. We have a better handle on impacts for current fiscal year, and we're still making projections about our next fiscal year. And each of the divisions will give you a little bit more detail on impacts in their area. Overall, I would say we're anticipating impacts in our fee-for-service areas, and those are listed there on the slides, where we provide direct face-to-face services. It's likely this fiscal year for sure we're going to have impacts, and depending on how long and what the rest of the pandemic looks like, there may be impacts into 2021 as well. This year's impacts will show up next year in terms of our fund balances and our contingencies that we're able to carry forward. And then I would lift up in particular that federal and state funding issue. Again, we know that the governor has asked all of her agencies to go through an exercise of identifying a total of 17% budget reductions. Know exactly which of those will move forward or how many of them will be necessary to balance the state budget, but it's likely that there will be impacts on our local budget that we'll get more information on as the next couple months move forward. On the other side of the slide, you'll see areas where we've identified minimal risk for us or some mitigation for risk. So for instance, the FEMA reimbursement is there. We know that our public health resources are being expended significantly to address the pandemic, and we are expecting that at least 75% of those will be reimbursed. In some of our areas, we're having grants that are coming through the federal legislation, so that's 100% reimbursement of those costs. So in those areas, we have some buffer and mitigation against those expenses. And then, of course, we're doing what we can to mitigate impacts such as moving to telehealth. We talked about that some last week, and Ron will talk about it again in terms of the community health center, and doing everything we can to contain costs in our discretionary spending this year. Next slide. The budget for these 8 divisions is what's reflected in the bar chart there to your right. You can see, again, most of our expenditures are in personnel services. That's what we do, is we help people with people. So we have an overall decrease in our budget. And as you go through the budget document, I think you'll notice a number of places where we have a truing up of budget. So you'll see decreases in capital expenditures and contingencies that reflect our capital expenditures this year. As the board members know, you've authorized a new building at DD and the purchase of an MAT clinic. So some of those one-time dollars are out of our proposed budget for next year. And also some areas where we've done truing up of the budget, and I'm happy to answer more questions about those as we move forward. I would also say there's some areas of uncertainty, and I know when we talk about the lane care budget, for instance, that's a place where, again, we're making our best guess about what that will look like as the landscape of having 2 coordinated care organizations is still really playing out for us in terms of our revenue. The only area where you'll see significant growth is actually in the community health centers, and I know that Ron will talk to you about that when we get to that area. So with that, I am going to start with Sean, who will walk through the admin budget, and then I'm happy to answer questions at the very end. So Sean, wait.
Thank you, Karen. Good afternoon. So the administration division provides support services to all the divisions in the department. And we also act as the department liaison for many of the divisions within county administration. The services that we provide include executive management, which is the director, the assistant director, and the health officer. And then we have planning and subcontracting, and they perform all of the contract writing, all of the board order writing, all the procurements, and they also do provider monitoring. And then we go into our fiscal services group, and they do the accounts payable, accounts receivable. They do grant reporting, the budget and accounting functions. They do payroll, and they also do our hiring and recruitment. The strategic development that Karen mentioned a little earlier, that individual is dedicated to seeking additional resources for the department, whether it be grants or other funding. And I'll speak a little bit more to that on the next slide. And then we have our public information area, which includes 1 FTE of our public information officer. And I'll go into more detail about what he has done this last fiscal year. It's been very impressive. You'll also notice in this proposed budget, we have asked for a 1 FTE accounting analyst. And this is to help manage the increasing workload. So I looked back the last 5 years to kind of see how big the department has grown. And since 2015, our budget has grown by 60%, and we've increased our FTE by almost 163. And we've also added some additional programs like workforce, and our grant reporting has become more complex. And during the history of Health and Human Services, we have not added an accounting analyst. So this position is going to help with doing more of the analytical work, the grant reporting work that we really need as things are more complex and a larger volume of work. The workload in administration with the impact of COVID-19 increased significantly, and that was a result of doing emergency procurements, getting emergency contracts in place, and then also working on just looking at the different federal stimulus packages and funding streams that could be coming in. We were successful in transitioning 72% of our staff from working at home under the stay at home order. In this budget, it reflects 22.10 FTE with a proposed budget of 3.3. Next slide, please. So as I talked about, the contract work is very significant for our department. Our active expense contracts total $40 million. That's up $1 million from last fiscal year. And we have executed 1,043 contracts, which is up 100 contracts from last fiscal year. And this does not include any activity associated with COVID. So this is all just regular operations for our department. The strategic development staff has identified $4 million in additional resources for our department, and also applied for 22 grants this fiscal year. So they've been very busy. And then the communication plan has been very robust this year. So our PIO has been very proactive in his outreach to the community, both working with neighborhood and downtown associations and in the response to COVID-19. So he has conducted over 360 national, regional, and local media placements, which were through broadcast, print, or online. He has done 41 press conferences, 81 individual interviews, and he's also had, I think this is very impressive, 9.6 million impressions. So that means 9.6 million people have viewed some information that our PIO has presented. We also have enhanced our internal communication with our department employees. So the director sends out a weekly email providing updates, and then we also have a newsletter that goes out to our staff, identifying focuses of the department or messages from the director. And then we also have staff conversations where the director and assistant director go to each Health and Human Services location, and they meet with staff, and it can be just a open question answer period for staff, or it can be more focused on and actually have a topic. So with that, I will turn this over to Lisa Willis, the Manager of Clinical Financial Services.
Good afternoon. Clinical Financial Services provides administrative and financial support to Lane County's federally qualified health center and components of youth services. The FQHC includes the community health centers, Lane County Behavioral Health, the medication-assisted treatment programs, and public health, maternal, child health, and communicable diseases program. Revenue cycle services include charge processing, payment posting, and AR follow-up for insurance and patient billing. We also coordinate provider and clinic credentialing with federal, state, and commercial plans. CFS is responsible for the configuration and support of the next-gen practice management system, which includes adding new payers, providers, and locations, as well as fee schedule updates and upgrade testing. Grant, state, and federal funds tracking and reporting are managed in CFS, as well as financial analysis, including clinic and provider performance. CFS is funded through service charges to the federally qualified health center. CFS is currently staffed at 13 FTE with a proposed budget of $1.762 million for fiscal year 2021. Next slide, please. Next slide, thank you. As you can see in the graph, the FQHC provided over 129,000 billed encounters in the current fiscal year. Encounter volumes were trending as an increase over prior years until the COVID impact in March. You'll notice the lighter shaded portion of each bar graph. This represents the medication-assisted treatment program encounters. MTP migrated to NextGen in February of 2019, so the change in numbers of encounters over the 3 fiscal years reflects only those encounters recorded in NextGen. While total FTE count for the division is 13, only 9 of those staff are dedicated to billing responsibilities, supporting over 140 providers. CFS is contracting with an outside consultant to evaluate system functionality and improve efficiency and increase automation to allow us to remain agile in response to the increased complexity of health services billing and reimbursement. We are also experiencing an increase in reporting and reconciliation requirements due to the capitation agreements with OHA and Pacific Source Community Solutions. The plans pay us a flat reimbursement per Medicaid member every month, which helps stabilize revenue and encourage outreach and engagement with the Medicaid population in our community. CFS will also provide reporting for federal funding in response to COVID relief disbursements to the FQHC. And with that, I will turn the next section of your presentation over to Ron Jelm.
Thank you, Lisa. My name again is Ron Jelm. I'm the manager of the Community Health Centers of Lane County. Our mission is to improve the health and wellness of our community through access to affordable, holistic health care. We have had a profound impact on our community. To give you an example, in the last fiscal year, we provided more than 82,000 separate encounters to over 32,000 individuals in our community. We do that through the services that are listed there in 6 different specific locations located all primarily in the Eugene-Springfield area, but we provide services to individuals throughout the county. I won't go through each of the bullet points of the types of services. You can see a range of adult, adolescent, and child services in primary care, as well as integrated behavioral health. I will point out a couple of things of interest that we have focused on over the past year. One is integrated oral health services. We have targeted a pilot program to integrate dental as well as primary care services for 2 high-risk populations. The first is adults with diabetes, and the second are children under 12 years of age. Both of those populations are at high risk for dental services or dental problems as a result of their medical issues. And that pilot program is something that we have received some funding from Trillium as one of our CCOs as a real area of interest to improve the health of our community. We have just a little under 200 FTEs, you can see, with an operating budget of a little over $33 million. The Community Health Center has no general funding. All of our revenue is primarily through fee-for-service billings, as well as some grant funding. Next slide, please. Certainly COVID has had a tremendous impact on our operations over the last number of weeks. Most notably, the first 2 areas, of course, our Springfield Schools Health Center are closed concurrent with the closing of schools, and we have suspended a number of services. Initially, the suspension of all of our preventive dental services that we provide throughout Lane County through school-based care. And to give you a sense of that, March through June of last year, our preventive dental services provided 8,400 separate dental encounters during that period of time. We will have no encounters in the mid-March through June. And that's another area where coming into the new school year, quite frankly, we're just not sure what September, October, November might look like in terms of our ability to provide dental services into the schools. In March, consistent with the governor's order, we suspended all elective procedures. We suspended well care visits, alternative medical services, some of our specialty care, put all of those and rescheduled those to later in the year. We're starting now to bring those back on a very slow basis. Within a couple days, quite frankly, the most profound change in our business was almost a full suspension of sorry, my light just went off, bring that back on. Suspension of in-clinic visits and a quick pivot to telehealth and phone visits. To give you a sense of what that looked like, within a couple days, we went from having all in-clinic visits to about 60% of our visits were phone visits, and it went up from there. I will say the impact of that in terms of finances is still undetermined. Telehealth, which you may be familiar with, those are the visits that you actually have that face-to-face contact. The governor put in an order, as well as the feds, to have those reimbursed at a regular clinic rate. Phone visits, we might get $10 or $12 for a phone visit as opposed to a full rate for a face-to-face visit. There may be some changes coming there, and that's why it's a little difficult to project the revenue impact of that. But quite frankly, we did that in a way so that we could continue to provide services to the members of the community. I'm really pleased to say, notwithstanding that overnight pivot of how we needed to provide service, we actually haven't had a significant decrease in the number of services provided over the last couple months, but a pretty significant change in how we're doing that. We've also on any given day, roughly 30 to 35 members of our staff who are working off-site, telecommuting, if you will. Next slide. Changes in our service that are projected for the coming year. We're projecting to add 10.8 FTEs by the fiscal year end, 2 physician slots, as well as 2 medical assistants. These are roomers, if you will, that assist the physicians in rooming patients. Additional patient care coordinators was important before, all the more important now. These are individuals we know, members of our community, will have more and more issues with what we call social determinants of health, and those are things like food insecurity, transportation issues, housing insecurity, and those care coordinators will help facilitate getting those individuals connected into the services that they need. We are looking to add a 0.8 associate medical director. Our current associate medical director, Rick Kincaid, has, I believe, 48 direct reports to him. So you can see the need for that, and then the other positions as identified. We also are still on track to open a new community health center site in Cottage Grove sometime in the spring of 2021. Of course, we don't know yet what COVID might do to that timing, but that still is on track. And we will submit a revised budget with budget as well as FTE when we have a better understanding of it, both the timing as well as the logistics of that opening. Next slide. And real quickly, just to summarize, there were some questions that came up before about metrics. We are all about metrics in terms of clinical as well as our operational performance. We have dozens of clinical metrics that we measure on an ongoing basis, and I'm really pleased to report that as a result of the close tracking of those metrics, we have seen year-over-year improvement in our clinical performance as well as our operational performance at the community health centers. We're looking to expand some services to make us even more efficient and effective in the coming fiscal year. Telehealth, I mentioned, on-site kiosks that will allow check-in and connection with patient portals, electronic communication. As I indicated, the expansion of a Cottage Grove site, and I'll put a question mark on full service dental. That's an area that we are exploring, perhaps as part of our introduction into Cottage Grove. Thank you. And with that, I will turn it over to Carla Tazimal in Developmental Disabilities.
Okay, thank you, Ron, and hello, everybody. I appreciate the opportunity to share with you information about the Division of Developmental Disability Services. This slide provides an overview of the division. It includes the mission statement, as well as a photo of an individual that we provide services to. And on the slide, you'll see a list of our core services that we provide. Those include intake and eligibility for individuals interested in accessing our services, as well as investigations of abuse and neglect. We provide case management to over 2,600 individuals of all ages. Individuals can access our services soon after birth, and once determined eligible, remain in services through death. In addition to services provided to individuals, we provide services to a variety of community providers. We facilitate certification, licensing, and employment for over 1,800 community providers, such as foster providers, as well as personal support workers. In light of COVID-19, we did make some changes to services. The state, prior to COVID-19, our services were primarily face-to-face and by phone. However, as a result of some state guidelines, temporary rules that allow for us to meet with individuals by phone and virtual meetings, we are very rarely seeing people in person at this time. We have closed our lobby to the public and are providing services by appointment only. The lobby is extremely small, which has made it difficult to provide effective social distancing, which led to the closure of the lobby at this time. In addition, currently 80% of our employees are teleworking 1 day or week or more per week. They often come into the office 1 day or more to access, for example, the copiers, the technology that they don't have at home, as well as access some files and paperwork that is here. Once the rules change in terms of the state guidelines to require more face-to-face visits, we do anticipate that we will have more people here again in the office. Also, as a result, let's see, one more piece on this. I wanted to go ahead and say we have about 87 FTE right now, and our budget is 11.3 million. Next slide, please. So this slide here depicts the overall growth in services that we've experienced over time. Developmental Disability Services is an entitlement program. That means everyone determined eligible receives services, and as explained previously, once a person is in and receiving services, they're eligible until death for the most part. Wait lists are not authorized. Over the past several years, the number of individuals has steadily increased, and since 2015, we've added more than 1,000 people to case management services. The increase has been fueled by the expansion of supports that people are able to access in-home. Since in 2015, 20% of individuals receiving supports were doing so in-home, in an in-home setting. And this year, 50% or more were receiving services in an in-home setting, as opposed to example to a residential setting such as a foster provider or a group home setting. The bottom chart here is a projection of the future growth based on the prior 5-year trend. Currently, we're located in the basement of the Public Services Building. Given the continuing growth in services and the needs to improve access to services for clients we serve, we've been in the process of planning for a new building to be located on the same campus as Lane County Behavioral Health and Youth Services. This will not only accommodate growth and allow for improved access for clients to receive services, but will also allow for greater coordination of care with other divisions. Of course, we'll be keeping an eye on what's happening with the state budget, but we're fortunate at this point because we have been able to maximize revenue these past few years and do have a healthy reserves. So I will go ahead now and hand it off to Steve Manella, the Human Services Division Manager.
Good afternoon. Human Services Division builds stable lives by empowering participants over time to develop social and economic independence. We do this by assisting households and individuals with their immediate basic needs and then linking them to appropriate public benefits, supportive services in the areas of housing, health, education, income, and employment. The Human Services Division, through its staff and public and nonprofit partners, serves over 50,000 people annually, including over 10,000 that are unhoused during some portion of the year. You'll see on the slide in front of you that we have a comprehensive list of services. The Human Services Division provides everything from homeless prevention and supportive housing services to low-income energy assistance and weatherization services, work experience and training, veteran services, service navigation for those folks that are part of our health and human services family that need additional navigation to social determinants of health. We provide regional anti-poverty planning. We manage a countywide management information system. And then we have a special initiative, which is our frequent user service engagement initiative, which targets the intersection of public safety, healthcare, homelessness, and mental illness. We currently have 42 FTE and a budget of a little over $20 million. Next slide. The Human Services Division has worked very diligently to address the crisis of homelessness. And we've done that with a partnership with our public agencies, City of Eugene and Springfield, as well as private nonprofit agencies, and have initiated that through our Poverty and Homelessness Board. This addresses the needs, gaps, resources for people without homes in our community. We are actively working on the implementation of the recommendations of the Technical Assistance Collaborative to implement coordinated outreach, expanded rapid resolution diversion, rapid exit strategies, increasing supportive housing, improving the coordinated entry system, and adding a 75-bed navigation center and emergency shelter. The Human Services Commission and our division is working with a number of resources that are coming our way to help the most vulnerable members of our community through this COVID-19 crisis. I want to mention a few things that are not currently part of the proposed budget, but are some things that will be of interest to board members and budget committee members. We received notice of rent assistance funds from the state of Oregon that were allocated by the Legislative Emergency Board, $929,000 for short-term rental assistance. That's money for direct assistance. There's no money for program delivery or administration. That's to pay rents of citizens of Lane County. We also received notice of the Federal Emergency Solutions Grant. This is part of the CARES Act, $986,000. We can use these funds for homeless prevention, outreach, shelter. This is the first of 2 installments that were part of the CARE Act. The second installment should be higher than the first installment. The federal government is to allocate that within 90 days of the passage of the CARES Act. We also received notice this past week that the state of Oregon is receiving $9.7 million of low-income energy assistance funding. This will probably mean about $1.2 million of additional low-income energy assistance. And then finally, our community services block grant, we should receive somewhere between $900,000 and $1 million in additional community services block grant. This is funding that we get from the federal government to address the needs of anti-poverty services. And specifically, you know, given the COVID crisis, we have a lot of folks that are impacted, that are housed individuals. And so this money is a little more flexible and a little more broad to address issues of poverty, everything from hunger to domestic violence services and the like. Additionally, the E-Board approved $3.5 million for emergency shelter that is yet to be allocated. That funding is part of a cut list that was presented today to the governor by the Oregon Housing Community Services Agency. The Oregon Housing Community Services Agency is looking at taking cuts from revenues that they haven't programmed. Also, the Speaker of the House is requesting an additional $200 million rent assistance funds to be allocated at an E-Board or special session. And the revenue for that would come from the $1.6 billion that the state received from the feds for COVID-19. I'll turn it over to Lisa Ross, our Lane Care Manager.
Hi, everybody. Lane Care works with our most vulnerable in our community through care coordination, education, and advocacy. We have 2 embedded teams within our coordinated care organizations, which of course are Trillium Community Health Plan and Pacific Source Community Solutions. These teams focus on care coordination for our Medicaid population. We also have our choice program, our older adult behavioral health initiative, and run the system of care governance structure on behalf of the CCOs. These programs focus on system-wide care coordination for specific populations, including our severe and persistently mentally ill, older adults, and children and families. The pandemic aside, this has been a huge transition year for Lane Care and adjusting to 2 CCOs at the start of 2020 and our role within these organizations. Despite our budget deficit, which you can see, we have significant reserves that will allow us time to gain more clarity on our direction and scope. We also will be entering into contract negotiations with Trillium within the next few weeks. Next slide. We continue to have great success in our public-private partnerships with our CCOs and have built strong alliances that have been really helpful in our work together during this pandemic. Our focus remains on monitoring and the stabilization of our behavioral health network and enhancing our crisis systems. And now I will pass the baton, as it were, to Jocelyn Warren, our Public Health Division Manager.
Thank you, Lisa. Last year, I began my presentation by noting that new public health issues emerge regularly. And I was referring at the time to natural disasters such as wildfires or man-made problems, such as the aggressive marketing of marijuana and tobacco to youth. This year, we have a novel public health issue, but what hasn't changed is that governmental public health is responsible for protecting the community's health, and we respond to whatever the need is. In addition to disease prevention and control, we do wider community health planning and collaboration with community partners, deliver services to pregnant women and families, and provide environmental health services. I'll note that public health receives general fund support in disease control and investigation, and Lane County has also made a particular investment in the health of pregnant women, new mothers, and young children with general fund support for WIC and nurse home visiting programs. Public health has about 87 regular staff working in over 25 programs across 6 sections, and that hasn't changed much from last year. Our budget is about $16.3 million. Although at the moment, we have many more staff from across the county doing really great public health work in response to COVID-19. Next slide, please. So there are a few particular areas of operation I'd like to highlight for this current response, and apologies, commissioners, this will be a little redundant for you who are well-versed now in the response. First, the call center was stood up early in the response to answer people's questions and concerns and to relieve some of the burden from the health system partners, especially our hospitals. The call center continues and has also been a great source of information for us. We get an idea from the call center about the concerns that people have and what is circulating in the community. And then we're able to share that with our IC and the PIOs. Our CD staff have been very busy from the beginning in conducting disease investigations with every new case. They're ensuring cases and contacts are supported and responding to providers and their needs. And you may have heard about contact tracing in the news. So that's the core work of the CD team, and that will be expanding. And I'd also like to call out the environmental health staff who have been doing regular inspections at our emergency shelters, working with local restaurants to comply with the stay-at-home order and to deliver services safely, and responding to requests like the one this morning from the circuit court, asking for guidance on how to set up hearings and courtrooms to be as safe as possible with the reopening. Finally, staff not working on the COVID response are delivering important services and preparing the community for reopening once we have received approval from the governor's office. And that's it. Next up is Lisa Nichols, Quality and Compliance Manager.
Thank you, Jocelyn. Good afternoon. The Quality and Compliance Division serves to meet important and growing needs across the department, including the areas of data and analytics, compliance and risk management, electronic health record support, and quality improvement. During the COVID-19 response, Q&Z transitioned to telework for 92% of our staff and has maintained high performance and productivity during this time. And I'll give a few examples of that in just a second. The data and analytics team serves to use data for insight, understanding, and decision-making. They take data and transform it into information that can be used to drive improvements, meet required metrics, and inform our staff, our funders, and our community partners. Over the past year, the team has assisted with a number of important projects. These include coordinating with HSD on creating visualizations for the TAC implementation, and more recently working with public health and the EOC to produce reports used both internally and externally on the COVID response. For the area of compliance, it is our task to complete department level work to ensure adherence to regulatory requirements. Examples of this include HIPAA privacy and oversight of the formal compliance program that's required by the Office of Inspector General. Over the past year, compliance has increased its presence and support for the divisions, including comprehensive risk assessments and associated mitigation activities and implementing compliance-related trainings. The electronic health record team, they work to provide day-to-day support and training on NextGen, which is the platform that is used by the CHC, behavioral health, the methadone treatment program, and MCH, maternal child health. This work includes responding to staff questions, updating, creating new templates, and performing necessary patches and upgrades. In response to the COVID-19 emergency, this team rapidly implemented the needed technology to enable telehealth services through our EHR platform. Next slide, please. So this graph on the second slide highlights some of the work of our quality improvement area. One of the major projects over the past year for quality improvement has been the rollout of monitoring of social determinants of health tracking. Ron referenced this a little bit earlier. I know this slide is difficult to read, but Ron mentioned some of the social determinants of health that we track, such as housing, employment, transportation, and a number of other measures. This project helps to better gather data and evaluate our patients' needs, so HNHS is able to best utilize our resources and meet the needs of our community. This work will be even more important as we move through this COVID-19 event. Our dedicated QI analyst has led the charge in this project, as well as providing support to the division level QI projects across the department. Thank you, and now I'm going to turn it over to Katrina Inman for highlights and challenges and opportunities.
Good afternoon. Thank you for your time. I get to start with some highlights for the year. The first image is showing projects done by quality and compliance. You just heard of a number of those, and they just provide incredible support across our department, allowing for continuous quality improvement. The top middle picture and the bottom middle picture are kids that are part of our developmental disability services. And actually the pie chart on the bottom right shows that 42% of those served at developmental disabilities are between the ages of 0 and 17. The graph in the upper right corner shows our active by name list, showing those people actively engaged in homelessness services. We have more than 3,721 people that have been engaged in the last 90 days, and you can see we can start to break it down by those that are disabled or chronically homeless. This information allows us to serve our community much better and in collaboration with our partners. The middle line here shows a number of pictures, some of our prevention staff that are supporting upstream solutions for our community. And then there's two pictures of our MLK Commons, a beautiful public-private partnership and support of 51 permanent supportive housing units in our community that broke ground in the fall. And lastly, the bottom left is a table showing the demographics of COVID in our community. We've had 60 community members impacted. Most have recovered, thank goodness, and we've lost 2 of our community members. You can see we've seen a pretty even break between men and women, and most people impacted between the ages of 40 and 49. Next slide, please. So as we look towards next year, our future challenges and opportunity, of course, impact is on our minds. The impact that this means for state and federal funding, the economic impact this means for our community and our clients. We already were facing affordable housing and homelessness crisis here in Lane County, and we see this need only growing with COVID. As has been mentioned by a number of my colleagues, social determinants of health, those social needs, food, transportation, are just going to be growing as we respond to our current environment. We're thrilled to be opening a new clinic in June in Cottage Grove, allowing greater access to our rural communities, which is really important to us. And you heard a little bit about enhancing coordination, care coordination at the community health centers, but we're also looking at this across our H&HS department so that we can serve our community as effective and efficiently as possible. Next slide. Of course, our strategic plan needs to be our guideposts as we move forward, and we will continue to prioritize implementation of supportive housing, working very closely with Home for Goods, a critical partner for us here at Health and Human Services, increasing access to primary care. The focus on equity and community engagement is a key part of vibrant communities, and our work with our advisory committees and boards will be critical as we must listen to the needs of our community and respond. And then the new developmental disabilities building that will be breaking ground this year will add to our robust infrastructure. And lastly, as we spoke at our last budget presentation, our people and our partnerships are absolutely our greatest asset, and we will continue to be working closely with our partners to serve our community the best we can, and continue to be engaging and working and supporting our amazing staff through training, development opportunities, and increasing our trauma-informed practices here at Health and Human Services. Thank you for your time, and I'll turn it back over to the chair.
Very good. Thank you, everybody. Questions from committee members? I don't see any hands going up. Anybody from the phone? Peter Dale? Oh. Okay, Chris, you want to go ahead and go first, please?
Sure. Just one question for Ron Helm about the impact of your programs. When I think about what I understand about your programs is that one result would be keeping people out of emergency rooms and the expense that costs. And I'm wondering if that's something that you track. Also, you mentioned the year-on-year improvement in metrics. And I just wonder where we can get more information about those.
Sure, thanks. We absolutely do track our emergency department utilization. That is through coordination with both now of the CCOs, the coordinated care organizations. You know, one of the things that makes it a little more challenging for the population we serve is many of the folks who we serve are homeless. So that is a component. As we track emergency department utilization, we break the ED utilization down into different cohorts to get a better understanding of the demographics of the individuals and their varying use. I'm happy to share in more detail the clinical indicators that we track and the improvement that we've shown over time. So I'll send that through Kachina.
Thank you. Commissioner Bosovic.
Thank you. I've got two quick questions. First one for Steve Manella. Has Lane County ever done rental assistance distribution?
Can you state that again? I was unmuting my...
Sorry, has Lane County ever done rental assistance distribution?
Lane County has done rental assistance distribution through nonprofit agencies, through our community service centers, such as Siusla Outreach Services, Community Sharing in Cottage Grove, and Catholic Community Services, and then some through St. Vincent de Paul as well. We have not directly had a county program. And what I can tell you right now, with the scope of the dollars that are coming from the state and the federal government, we will have something much more akin to what we do with the low-income energy assistance program, where we will need to both work with our nonprofit partners as well as look at the way we can process rent payments as a county.
Thank you. And I guess my second question's for Jocelyn. How long has the county supported some of the preventative well baby care, like the home visits and the WIC enhancements? With
For how many years have we had those?
Yeah.
Well, WIC has been a very long time. It started as not, and Karen has a lot more history in this than I do, so she can chime in too. But
in particular, Jocelyn, I'm looking for how long has the county supported them with general fund monies?
As long as I have been here. Karen, do you have a better? And part of the thing to know about maternal child health services is the support is in match. So it allows us to draw down the Medicaid dollars as well. The WIC funding has changed over time. Karen, do you know what the change for that has been?
Thank you, Jocelyn. I'm happy to weigh in, and my answer would probably be similar to what Jocelyn's was, which is as long as I've been here. What I will say is so there have been several rounds of significant budget reductions over my 30-year tenure with the county, and both WIC and maternal child health have historically come out high when the criteria is applied, not only about what programs hit critical needs in the community, but which programs are able to leverage resources significantly. And Jocelyn just indicated that piece of for maternal child health, it is a Medicaid match. So for every dollar we spend, we're able to bring in significant federal dollars that help provide those services in the community. And with WIC, by running that program, we enable all of those food vouchers to come into the community in support of that. So, so both of those, despite when the county has had significant budget reductions, both of those programs have continued to come out on top.
Yeah, I sort of knew the answer to that one because I was here when we made those significant budget reductions in 11 and 12 and 13. And that program we kept the support of because we understood the benefits, long-term public health benefits of getting those babies off to a good start. And that was an all-male board that made those decisions. So just saying, I just want to try and point that out that, you know, that we were doing that in accordance with our strategic plan at the time and our community health improvement plan. It was a major goal of ours.
Thanks, Commissioner.
Commissioner Farr. Thank you, Pete. I'll get you next.
Thank you, Chair Bloodman. You know, Karen and everybody else, I can list your names: Carla, Star, Jocelyn, Katrina, Lisa, Pauline, Ron, Ryan, Daniel, Steve, Sean. It's amazing every year when I see the numbers that are generated by these departments, by the Health and Human Services. It just blows me away. When I first came onto the as a county commissioner 8 years ago, even after serving 10 years as a Eugene City Councilor, the sheer numbers were just astounding. Ron, 32,000 individuals being served with primary care in our community health centers. That's a remarkable number that is, I mean, it boggles. Steve Manella, 50,000 individuals being served annually by our Human Services Department. Karen, 700 FDEs total throughout the departments. It really is just amazing how much you juggle and how you can find time right now to juggle the emergency business that you're taking care of at the same time, because much of the emergency on COVID lies right on the shoulders of the people, the staff in this department. So it's really remarkable how much you can do and still find the excess energy to superbly handle the extra work that's happening right now and will be happening for quite some time. One last thing, I just wanted to mention the numbers are just amazing. For someone first coming onto the budget committee, it might be kind of surprising that we have such huge numbers. Ron, I'm just going to mention something that you said. There were questions that you heard about metrics during the prelude to your presentation. And I was pleased to say, and for you to hear you say and report, that we have dozens and dozens of metrics that we track and we keep track of and use them to govern our daily work and our daily projections. So I am proud to be a part of this department. Man, I'll tell you what, every single time I hear the numbers, Karen, it blows me away. So thanks very much for all this hard work. And in particular right now, thank you for the extra work that you personally, but every single other person presenting with you and all their reports, including the 42 reports to Rick Kincaid, are performing at the current point in time. Thank you.
Mr. Chair and Commissioner Farr, I just, from the bottom of my heart, thank you for that appreciation and also acknowledging the amazing team that we have at Health and Human Services. This work would not at all be possible if it weren't for not only the individual expertise that each of these leaders bring, but really the coming together as a team that has brought fantastic innovation and energy and passion to the work that we do. So thank you for that.
Commissioner Sorensen.
Thank you very much, Mr. Chair. And my first comment is that Commissioner Farr expressed my view really well in terms of just how much we appreciate, on behalf of the people that we represent, the phenomenal work of this department under these circumstances. So thank you for all your hard work. My second point is that back in 1995, maybe 1996, Representative Kitty Piercy and Senator Pete Sorensen met with Rob Rockstro, the director of Lane County Health and Human Services at the time, to urge the county to take over WIC, and it did take over WIC, and there was great concern at the time that WIC would not have an administrative home in our community. And I think it's been a good decision the county made 25 years ago to accept the responsibilities. And I'm glad that we are continuing to invest in that program. And then third, my question has to do with the community health centers. And that is that when we started that program, when Steve Manella and many others were involved in getting the original funding for the community health centers, we were nervous, I would just say on behalf of the board 15 years ago, we were nervous that the funding for the federal government to fund it would occasionally be insufficient. We have to put general fund money into the program. As far as I know, we have never done that. We've never put general fund money into the community health centers. But I just want to ask Mr. Jelm if you could tell the committee a little bit more about that topic and whether or not, given the current environment, both medical and financial, where you think it's going in terms of any need down the road for the county to consider general fund money into the very, very successful community health centers program.
Sure. Thank you, Commissioner Sorensen. And before I answer that, I'll just clarify for Commissioner Farr. In terms of the 32,000 plus individuals we served last year, you made the mention that was 32,000 primary care. It's about 26,000 primary care, and the balance of those are kids who are receiving dental services. So just a little clarification there. And now, Commissioner Sorensen, there was a time before my time with the Community Health Center, I believe it was a year and a half, and Steve could correct me if I'm wrong, that the Community Health Center did receive some general funds to get off the ground in the first maybe year or two of the activity in 2004, 2005. Since that time, we have not received any general fund. Good news, bad news. The bad news is we didn't receive any general fund. The good news is we had to be able to balance our budget on the basis of our federal grants as well as fee-for-service revenue, and we've been able to do that. One of the strategic directions we have been on really for the past number of years is to change our reliance from fee-for-service billing, which is you see a patient, you bill for that service you provided that day and you get reimbursement. We have moved much of our primary care service funding from that fee for service billing to a capitation arrangement, which is where we actually receive a per member per month a capitation payment for those individuals who are assigned to us and receive services. And about 70% of the activity we provide is Medicaid. And the bulk of those individuals now are under a capitation arrangement. All of the state revenue for Medicaid we receive is capitated, and about 60%, 65% of the coordinated care organization funding we get is capitated. And that has been a really important component over the last number of months as our visits have fallen, and particularly the way that we're compensated for those pieces that are still fee-for-service. It hasn't had the profound impact you may have seen in the community, how much revenue has fallen for a lot of private practices that are still traditional fee-for-service revenue, and it's had a much smaller impact. I won't say that there hasn't been impact, because all of our dental services are still fee-for-service, and that's been a big impact on our revenue. But we are pretty confident we'll weather the storm. We have received a little over $1.7 million in additional grant funding in the last 2 months from HRSA, the Health Resources and Service Administration, related to COVID activities. And that will go a good way to helping recover much of the revenue that we have lost. Of course, it's hard to predict what this will look like in the coming months and how long. So hopefully, Commissioner Sorensen, that answers your questions.
Thank you so much, and keep up your good work. And I hope we keep the community health centers program for many years to come. Thank you.
Thank you, Commissioner.
Larry Abel.
Hi, I've got, as usual, a few of my bean counter questions. So page 186, the summary, the financial summary, fees and charges went up about $4 million, 22% from last year. Does anybody know why that happened? Why it's going to happen?
A number of us do. Sean, do you want to start, or do you want me to start?
Would you go ahead and start? That'd be great.
And I may miss some of the divisions, so please feel free to chime in. As I looked, that page 186 is a little hard to sift through because it really is a roll-up of all of the divisions in the department. So the largest place where that line item increased, I believe, is in the community health centers. So, and Sean's going to correct me if I'm wrong. Remember last week I said all the hard questions go to Sean? So this is one of those times. But really, in terms of our most significant growth, it's in the community health centers. So I think that's where the largest part is. Sean, do you have anything else in terms of that line item?
No, we increased by over 3 million in the community health centers, and that's where that's where we're recognizing the increase. There are small increases in other divisions, but overall, that's the main one.
That's great, thanks. Next on the admin, I noticed that materials and services went down, yet we're talking about anticipated changes, increased expenditures for maintenance and enhancement of electronic health record, and increased expenses related to the design and development of the new building. So I'm just wondering, with those projected increases, why did materials and services go down?
Sean, do you want to do that one?
Yeah. So I'm unmuted. So there are significant decreases in both our materials and services and our contingencies. So we moved for administration, we moved money out of our contingency and reserve to help purchase the methadone building. We're anticipating that that will be reimbursed through earned revenues once we actually start utilizing the new building and increasing the number of clients that we see. And then the quality and compliance that kind of rolls up into administration, they reduced because we have budgeted about $250,000 for office renovations. We actually didn't need to use that money. So that decreased. So there's those differences. Are there other specific line items that you're looking at?
No, that just seems to cover it. I just wondering why it went down. Can I go back to admin for a second? And I noticed there was a line item, mental health settlement contingency, that went to 0 this year.
Yeah, so that was a mental health settlement that I don't know the whole history because I've only been here a year, but we were holding on to that to make payments in part of the settlement, and Karen could probably go into the detail. The length of time or the statute of time for that settlement expired. And so we closed that account out and moved that money into behavioral health and a portion of it into developmental disability services, because that's where it was housed. As far as the background, I think Karen can provide that.
Yeah, I thanks, Sean. I can quickly do that. Lane County serves as the community mental health program as well as the community developmental disabilities program, which means that the state Department of Human Services and Oregon Health Authority pass through significant grant dollars to the county that then we pass through to not-for-profits, subcontractors in the community. And years ago, it actually was more significant than it currently is. And at the end of each biennium, we would need to do a settlement process where we worked with the not-for-profits to get their final expenses and reconciled it with the state. And at one point, the state actually fell several biennium behind in doing that reconciliation. So we reserved those dollars until we could complete all of those settlements. And this year, in preparing the budget, we realized, as Sean said, the time has expired. And so we were able to disperse the revenue that was left in there to the programs.
Sounds good. And the last one is for Steve. I noticed in your budget, the FTEs are the same, yet personal services went down, is going down next year.
Yeah, I can tell you why that is. It's a combination of factors. There have been some overall savings in healthcare costs. We've had some retirements, so we have people coming in at a lower rate. And then we have a vacancy variance that is part of our budgeting process this year. So those three elements probably make up the difference.
Yeah, I think the vacancy variance was there last year too, though, wasn't it?
I don't think that I don't think that last year, and Sean can correct me, but I don't think last year we budgeted that for the Human Services Fund for Fund 285.
That's correct, Steve. That was not budgeted.
Okay, that covers it. Thank you.
Other questions from committee members? Yes, Commissioner Burney.
Thank you. While I think all the kudos and the appreciation for passion and dedication and what have you are deserved, and I've joined in them, I hope my questions are not misinterpreted as not appreciating all of that. First off, I think we all ought to give some of those kudos to the people that are actually delivering services, which are none of us on this call, I don't believe. And those frontline workers are exposed to COVID, they're exposed to other germs, they're in there doing their thing. And I do understand that we're talking about the superstructure that allows that to occur. But I do have a few questions. First, a statement. Steve Manella. On the Human Services Commission several months ago, I requested a list of all those nonprofits that are part of the support structure of community services, even though they were not getting dollars from your agency and the Human Services Commission. That is not yet forthcoming. And the reason I mention that is because I, for one, and I may be a voice in the wilderness, am very concerned with the notion of you beefing up staff to take on the role of service delivery when you're talking about these additional dollars, as opposed to looking at strategic ways to divert those dollars, hopefully with zero administrative fee, siphoning them off to community groups that already are paying their people not enough money, that need to expand, that are already positioned in the community. So, and maybe I'm reacting to something I shouldn't, but when you said, when you're looking at the kind of dollars now that are going to come in from the state, that you may be looking at, you know, how you can provide rental assistance payments or you can provide energy assistance payments. I just think philosophically, I don't agree with that for what that's worth. So as you're looking at budgeting, there are budget implications. Now, a couple of questions. Steve, unless you want to tell me I'm all wet, which you have the right to do.
Well, Commissioner Burney, I appreciate your question and comments. You know, we will have an opportunity on Thursday to talk more about our homeless initiatives and our rental assistance program. And, you know, at that time, I can share more with you about the plans, but you know, we have always first looked towards the our community nonprofit providers as a way of getting resources out. And however, you know, we grew, even before the COVID, we've grown by about 40% in particular in our homeless and supportive housing program. And even to get be accountable and get the money out to the nonprofit agencies and report back to the state and federal agencies, we have to have an infrastructure in place to do that. And we've done that in a very lean way and not top heavy. So I'd be glad to share that information with you.
Thank you. By way of full disclosure, Steve and I first met 10 years ago when I was actually evaluating some of his energy assistance programs. So that's just sort of, we'll do that Thursday. And Steve, I apologize if I brought that up in the wrong forum. It's phenomenal, the fact that most of this budget is essentially an enterprise budget, correct? It's not impacting county dollars. I presume the difference between the dollars brought in and the cost of delivering services is what we're calling reserve funds for different divisions?
Commissioner Burney, I appreciate that question. And it's interesting, Sean and I have talked some about the way things are displayed on the slides, and that difference between resources and expenditures I find very confusing. So I'm gonna let her take a run at explaining why those numbers are different when I know that on the ground, our managers are balancing their budgets. So Sean, you wanna take a run at that?
Yeah, so there are several areas in which our expenditures and resources don't align and on the slides, but they do in the budget. So there are, for example, you look at human services, for example, and their expenditures are 19.5 million. Well, there's also an intergovernmental human services fund where there are some resources in there. So part of it, you have to look at funds where if you look at the budget book, there's total resources, total expenditures, and then the bottom line. And then there's also a section just below that that has funds. And so we dip into those funds for additional resources. And that's not displayed in those slides. Okay. And I had a conversation with Christine about this. Doesn't make sense to me. So, but she explained it, and that's where the balancing comes in.
Christine always explains to me what makes no sense to me, and I come out and it makes complete sense. However, sometimes you will come to the Board of Commissioners and reserve funds are used for construction funds or for contributing to capital improvement. So again, do those funds build up and are they specifically for capital improvements?
Commissioner Burney.
Oh, sorry, Karen, go ahead.
I'll start and then Sean can fill in.
I'm sorry, yeah.
With details. No, I was actually surprised that this issue hadn't come up before because I found it very confusing too, that when we talk about budgets here at the program level, when we're pulling numbers from the fund level, there's some dollars that aren't shown on the slides or even on the specific budget pages. So to answer what I think your question was, Commissioner Burney, in terms of those contingency funds, reserve funds, capital expenditures, so those are all contained in each of these funds. So for instance, Sean talked about how within our admin program, current fiscal year, we had money budgeted in contingency that then we moved out this year to spend toward purchasing the building for the medication assisted treatment program. So those funds then are not being budgeted next year because they have been spent. So if they're, and I often get this piece reversed, so I'm sure Christine or Sean will correct me, but I believe it's contingency monies that we actually have. If we're going to move to spend those, that actually has to happen during a supplemental budget process with a budget hearing before we're able to move those out. And reserves we're able to do with board action to be able to expend those. So those monies are contained in the funds themselves. And in those two categories, we actually have to have board approval in order to move them to a place where we can spend them. I don't know, someone with a finance background want to correct me?
No, I'm not trying to pin you down. I'm just trying to understand.
Part of what you see here, and Christine, correct me if I'm wrong, incorrect on this. This is our operating budget, and contingencies and reserves are considered operating, and also fund balance isn't considered operating. So you wouldn't see those balances in this particular budget document.
Okay, just a couple more. Oh, I'm sorry.
Commissioner, I can point you towards just a couple pages maybe that might be helpful. Sure. Just for reference. And this does go back to, I discussed it a little bit on the first evening, where there are pieces that are part of a department budget, and then there's pieces that are part of the fund budget. So that's the difference that you're seeing here. You're seeing the department's budget, which will include only personnel, M&S, and capital. And then the other pieces of the budget, fund balance, reserves, contingency, those legally belong to the fund.
Can you give me a page number?
Yeah, you can find that fund information. The contingencies are all listed by fund on page 89 of your budget document. And then the reserves are on page 93 of the budget document by fund.
Thank you.
Hopefully that helps.
Thank you. Chair, I'm going to just two more because I'm sorry I'm taking so long. Lisa, is it correct or not that billing is lagging with some of the community health centers to the point where it may have implications for cash flow?
So that terminology is kind of in a variety of ways. So okay. I want to make sure I am giving you the right information back. So in terms of charges coming into the system as a result of services provided, we are not seeing a huge lag. They're not lagging in a sense that we are not receiving those services to be billed out to the plan. Okay. We do get those charges out the door in a timely fashion. They're processed. within generally a week from the end of the month. Everything has been processed for the prior month. So the claims are going out to the plans. Where we might see a hiccup in that revenue coming in is whether the claims are held up at the payer or the payer isn't paying them as expected and it requires AR follow-up by my team. And that's routine for a billing team. That's what we do. That's why we're here. So in terms of a lag on billing, I would say no, that is not an impact to the revenue.
Thank you so much. And Ron left, but I was going to say, every time I hear Ron and every time we have these discussions, I feel sicker and sicker. I'm in that I am an adult that for 58 years has had insulin dependent diabetes. And now I find out that I'm supposed to have even worse dental situation. But
no, I was just suggesting that you may be at higher risk, which is why we have that integrated oral health to make sure that you and folks with diabetes get the care they need.
Thank you thank you, Mr. Chair, for all this time. I hope I didn't bore the group. Thank you.
Commissioner Farr.
Thank you, Chair Lodeman. I just need to respond a little bit, and I'm going to talk directly to you, Mr. Chair, about Steve Manella. You know, he's been around for a long time. I met Steve Manella 25 years ago when I was first appointed to the Human Services Commission. And since then, I've seen him distribute millions and millions and millions and millions of dollars directly to the people who need it. You know, earlier this year, somebody called Steve Manella the man. Steve, are you laughing about that still? Because of his responsibility for administering the budget that he administers and the direct services that he personally administers. Now, something that many people maybe don't know about Steve Manella. We all talk about our community health centers. We talk about federally qualified health centers. That was Steve Manella's idea. Now they are nationwide. Steve Manella invented that. And Steve, you're not going to talk about that yourself. You're going to kind of try to shed the accolades that I'm trying to give you here. But I know for a fact, and I heard it from Congressman Peter DeFazio, that Steve Manella, you are responsible for it. So, you know, I hate to hear criticism of Steve Manella. I hate to hear it. Steve will sit and listen to it, and he'll smile about it, and even laugh about it. But I hate to hear it. Thank you.
Other questions from committee members? Okay, seeing none. Thank you very much, Human Resources Group. That was very good. Appreciate it. Or Human Resources, I jumped ahead, sorry. Human Services.
Thank you.
Okay, let's take a break, committee, and reconvene at 4:10. So about 6 minutes from now, please. Thank you. Mr. Finch, why don't you go ahead and take it away?
All right, thank you. Good afternoon, everybody. Thank you for being here to listen to our budget presentation, and good afternoon. My name is Mike Finch. I'm the Director of Technology Services, and Lauren Blythe is here, our Senior Manager, to help present our budget to you today. As we take you through our budget, I would like to highlight 4 themes that are woven into what you're about to see. Those themes are security, Office 365, data and analytics, and keeping up with growing demands for technology services for both existing and new services that have come in, including our new phone system. Of course, we also want to acknowledge COVID-19, which, interestingly enough, tied directly to each one of the themes I just mentioned to you. For COVID-19 response, we needed secure remote access to keep our county running and our people safe. We worked quickly and securely to set up nearly 900 employees in a period of a few weeks. We also assisted with opening up telemedicine services, providing electronic in and out board for team communications, and the expansion of our new phone system for services for the EOC and many, many other needs. We leveraged our initial investments in Office 365 configuration to provide a limited Microsoft Teams site to our Emergency Operations Center. When it comes to data and analytics, we have staff working hard to integrate more data sets into our data warehouse than ever before, so that our skilled GIS and Tableau teams can provide the analytics and information we need to make the best decisions. And finally, we recognize the many other projects and requests for work, including PC replacements and Windows upgrades that had to pause for a time, but we're now working hard to get that work back on track. As part of all this, I want to mention that, like many others, we're recognizing the potential benefits in all of this. We're asking and looking at what role technology will have going forward now that the world has changed. In offsetting traditional approaches to work, how can it help with expanding office spaces, parking, traffic, pollution? There's a lot to learn from all of this, and we're ready to capitalize on that potential. So those are the forces in our budget. But in kicking off our presentation, I just want to take a moment and say thank you. Thank you to the amazing people that work in technology services for their service at this time and always, and also to our partners for your patience while we worked hard to set folks up and meet everyone where they were at with technology to get them working successfully as a remote workforce in a really quick period of time. So thank you so much. So really quick, this slide gives you an overview of the 6 divisions in technology services that make all of this possible: administration, customer service and support, business services, technology infrastructure services, and our lane radio operability group.
So thank you, Mike. I'm Lauren Blythe, Senior Manager with Business Services Division of Technology Services. For fiscal year 2021, Technology Services operates out of 2 funds. Fund 654 serves as our operations fund and is where all of our personnel and support M&S are found. Fund 653 is our technology replacement fund, and there are no staff or overheads charged there. It's just funds set aside to replace technology as it ages out. Our resources come in through rates from countywide indirect formulas, department direct charges, regional services supporting City of Eugene, Springfield, and Elkhog, and replacement fund formulas. In FY 2021, our COVID-19 resource impact, there are some risks. This slide represents those risks facing our department. The primary impact for technology services in the county really stems from licensing costs for tools used for remote access and collaboration in response to COVID. This will impact other department budgets since we are an internal service provider. Fortunately, we were able to take advantage of several hundred free GoToMeeting licenses that go through the middle of June, and we're currently working to extend that as much as we can and take advantage of that service.
This slide represents our expenditures. As you see from the graph, it really breaks out our personnel, our M&S, and our capital expenses. So put some highlights for expenses this year built into this budget. We do have an office remodel coming up, which is a one-time expense that has been set aside over the years to take on. Office 365, that theme I mentioned, there's a built-in ask for some M&S there. I'll talk about that. M365 licensing for security, cybersecurity training and testing tools for our employees to help them be safe at work and at home. some pass-through for NeoGov onboarding module for HR, and 2 FTE, 1 in customer service support and 1 in business service division. We'll talk about those more in just a moment. And moving through the slides, I did want to take a moment to recognize our many partnerships in the community. We partner with the University of Oregon. We did have an open data study with their 3 p.m. program, talking about the importance of open data sets and community resiliency, something we're seeing today. Technology Association of Oregon, we were provided the opportunity to host a lunch and learn for the community on open data, which brought in many, many folks across the area to learn what that's about. The Technology Association of Oregon, the Oregon Association of Government IT Managers, and many other partnerships. Moving into our divisions, I will start with administration. This division is managed by Kelly Barlow, and it really provides all the support our staff need to work every day. Provides our budget services that you're having presented today, accounts receivable and payable, payroll, purchasing, contracts, recruitment, training, newsletter, events. And then new in this year, or I shouldn't say new, but a transferred FTE is to take on telecom billing, 1 existing FTE for a service that closed down on cartography that was moved in to take on telecom billing and other needs as an executive assistant.
So the Technology Replacement Fund, as mentioned earlier, Fund 653, the purpose of this fund is to help us budget for assets that have a known lifespan, such as PCs, infrastructure, routers, switches, things in the network and server and the data center, software licenses, copiers, and even phone systems, things that we know expire or age out at a certain point. The Customer Service and Support Division is commonly referred to as the help desk or the service desk. This is our tier 1 frontline technology support for the Lane County workforce. You call the help desk and it's this team that answers and hopefully get you back up and running as soon as possible. This team is managed by Kelly Barlow. New in fiscal year 2021 is a request for 1 FTE to handle PC replacements and service desk, handling those phone calls to help keep pace with the growing technology demands of the workforce. Business Services Division is our largest division in technology services. This represents our tier 2 services such as application support, business analysis, project management, field-based desktop support, database administration, GIS, and data analytics. We reorganized last year to align our resources with our department partners and grouping them into 3 areas of kind of common interest. Those areas or those teams are land, which represents public works and assessment and taxation. That team is managed by Brad Welch. Law, life, which represents Health and Human Services, Sheriff's Office, and the District Attorney's Office. That is managed by Kay Youngblood. And the Lane team, which is our countywide and central services representing Human Resources, County Administration, County Council, and Operations, plus our telecom operations. That team is managed by Scott Noble. And coming up in fiscal year 2021, we are really looking forward to continued development of our new telephone service, our telecom service, rolling out some features you'll hear about here in a minute. And we do have a request for an additional FTE for field support service or field service support, which is our greatest area of need, again, keeping up with the demands of our workforce.
Technology Infrastructure Services is our data center and all of the infrastructure we need to keep running. This team is managed by Cheryl Reedy. She and her team make sure that all of our ones and zeros keep flowing across the county and into the world. It's our networks, it's our servers, it's our data storage, it's our backups. It's also a huge part of our disaster recovery. They've made several, we'll talk about some successes, but investments in disaster recovery this year. That M&S increase for Office 365 is found here. It is a request for managed services to help us expedite the setup and the ability to take advantage of many of the features from Office 365. If we learned one thing, it's that these services are more important today than ever before. Microsoft Teams, OneDrive, but we need these services to because it is a very complex journey into the cloud, and we're taking our government and our county there to be able to take advantage of that resiliency and those services. So that's what that's there for. Cybersecurity and compliance. This division is managed by Kim Morgan. She is our cybersecurity and compliance manager. This group is absolutely responsible for making sure the policies and the tracking and the oversight are in place to make sure we're safe and secure. But they do much more. They also manage our physical access control, so door badges and our public records requests. There's an M&S ask here for training, ongoing know-before training that will provide testing and training tools for our staff so that they know when they should and should not click, and it will help protect them at work and at home. Builds a strong work environment and community.
So the last team I think we have is the Lane Radio Interoperability Group, commonly referred to as LRIG. This group manages the radio network that's used by public agencies and first responders across Lane County. There are 26 subscribing agencies, and they manage over 2,000 radios. And this program is managed by Mike Harmon. So highlights of this last fiscal year, well, while there were many, you see 9 or so represented here, I do want to call out 2. A big one, a big accomplishment for us and for Lane County was a new telephone system referred to as VoIP, Voice over IP. That included the deployment of over 1,400 phones and the movement of 85 physical faxes to electronic faxing. In the coming fiscal year, we're really hoping to roll out some new features that will cover or give us some expanded services around disaster recovery, conferencing, and remote phone services. Also noteworthy or worth calling out amongst these accomplishments is our improved governance, which resulted in the reestablishment of TISIC, which is the Technology Services Steering Committee, and introduced data governance in recognition of the hugely increased demand for data analytics, data integration, and business intelligence. And in light of that, we held our first data summit this year, a few months ago, and it brought together executive leadership and key department personnel to help us begin charting a path towards data in our future with a culture of partnership and sharing of data.
This slide represents many of the future challenges and opportunities that we have. Of course, COVID impacts beyond this crisis. There's possible investments in remote access and licensing, just to give an order of magnitude, it could be in a $100,000 range to continue the expanded LogMeIns, GoToMeetings, GoToWebinars via remote workers. There's a lot of licensing involved with taking advantage. This is just an order of magnitude. We are continuing, just to give you sort of a sense, but we continue to really look at what are the ongoing needs. At this point in time, we are taking advantage of COVID licensing packs, making it free. But those go into June. And so we're just watching what the road ahead looks like to give you an idea. Telecommunications system support. So as Lauren discussed, that's a challenge and an opportunity for the county. We have one person who is really dedicated to this program, and she is amazing. She does an outstanding job of bringing the system to life, but a one-person deep bench on any system as critical as this is always a challenge and a risk. IT service management system, so that's our ticketing and process control system. We have an older, outdated system, so we're definitely looking at it as a challenge and an opportunity. Security and compliance training and education, of course, we're looking to bring in those tools, getting them rolled out, partnering with our staff and our unions and HR to make sure that that's received as a wonderful opportunity and nothing to be afraid of. Professional services for Office 365 and the one-time investments for our remodel. So those are just some of the challenges and opportunities we're looking at in the coming year. This slide represents many places where we connect with the county strategic plan, from a safe and healthy county, of course, cybersecurity assessments and compliance, and remote access for workers, all the way through people and partnerships, and our regular growth and partnerships in our community and state and federal levels. And that's our presentation today. Questions?
Questions from committee members? Yes, Ms. Buck.
This is for Mr. Finch. As we're talking about more telehealth in our clinics, I was wondering what kind of pressure that would put on technology services. My brother works in technology services in a large hospital, groups of hospitals actually in San Diego, implementing telehealth machines, and it's a lot of work, and it looks like some place that we're going to and heading to fairly soon. So curious how that could impact your department.
There's really two primary ways. One is bandwidth. So of course, telehealth means video, and video streaming, it tends to be a higher bandwidth consumption. So that's something we look at the impact on our network as we're moving more and more onto it. We just moved our telecommunications, our phone system onto a network. We're taking advantage of video. Our network team is on top of it. They're really monitoring that flow and staying ahead, but that's one place that we will be watching. Yeah, the other, of course, is, well, I should say there's three areas. Security is the next one. So just making sure that we're tracking the services being used and making sure we have things like BAAs and other agreements in place and ready. But then the third is that hardware. So bringing in hardware and managing it and making sure it stays patched and going. So those are really the three of the bigger areas that we focus on.
Additional questions, Commissioner Burney.
I just want to say to Michael and Lauren that I would be drowning in murky waters were it not for your assistance. So even though I represent not even the tip of the iceberg of what we're discussing or the underbelly of the infrastructure you're putting together, I just thank you for it enabling me to do my work.
It's a pleasure to serve you.
Thank you, Commissioner.
Commissioner Bosevich.
Thank you. So, Mike, I know that the servers and the air conditioning required for them use a lot of energy. Is that in your M&S budget, the energy specifically for the server area of the PSB, or does that just get thrown into the whole PSB's meter and all of us that are in the PSB building are helping pay for the server costs? Just kind of curious how that's distributed financially.
I will put out a guess, but we have our budget staff on the line if they want to jump in and make sure. Correct me if I get this wrong. One, I did want to mention that our data center was remodeled and takes advantage of a lot of green energy opportunities with new pod technology and extremely efficient cooling. So that's been a big help in reducing costs over the years. Those costs do run through county indirect.
Yeah, I figured they ran through indirect. I was just wondering whether or not the energy budget of your was separated out for you guys and then distributed over the entire county's indirect budget, or if everybody that's in the PSB, like county admin and A&T, are subsidizing the server farm because we're connected with that meter. But I guess that's a detailed question maybe that can be answered by you and budget staff in a Q&A. Thanks.
You bet. I do also want to mention, though, that we do pass along some of that indirect to our regional partners who share that data center. So those who consume those services do help pay for the energy to run it.
Other questions?
Hey, quick question.
Yes, Mr. Hazen, please.
Yeah. Hi, Michael. Great. Thank you for the concise presentation. Love what you do. You got a great chance to talk it over in more detail as my budget buddy. So thank you, my budget buddy, Michael. Can you elaborate on the U of O open data study and what this, in particular, what this budget committee might anticipate in the next few years with regard to public information and community access?
Yeah, that study performed by several students in the program really focused on outreach to several of our local agencies, ourselves, City of Eugene, I believe participated, HELCOG and others, and really talking about open data, what they provide the community and what opportunities they are. Its centerpiece was identifying the fact that, smart communities, when we say those, a lot of times we think of smart gadgets and parking meters and other things, and that's part of it. But Smart Community 2.0 is really recognizing the significant importance of our communities providing data sets about what's going on. So universities, health, health agencies, law enforcement. We all have part of our story woven into everything. And so making those data sets available really builds community resiliency and the opportunity to take advantage of many resources and talents out there in analyzing that information and helping drive the best decisions for our community. And when I say open data, it's free, open, no barrier access to large data sets that you can bring in and interact with. And so that's a vision and a goal, but it's and so it's certainly something we look forward to continuing to partner with the community and learn more about and offer capabilities where we can.
Yeah, hope to hear more about that in the next couple of years, Mike.
Thank you.
Other questions? Mike, I have one for you, a little on security. So I think it was within the last year. I think it was Tillamook County got hit pretty hard by a breach and an exploit and a ransomware type of attack. What type of things are in place at Lane County to avoid a situation similar to that?
So we studied that one closely, and in fact, their CIO came and spoke at our Oregon Association conference and really gave us a wonderful presentation on the experience and what to look for. And it is common elements. They had moved to cloud backups. Of course, they're looking for backups. They moved to a cloud backup. The attacks today are sophisticated, and we're able to get in and get a hold of the backups and corrupt them along with the data it got in. It came in through an unprotected, unmonitored web service that had been hanging out there with passwords that had not changed. So some basic things. We, thanks to the investment in our cybersecurity program in the last half decade and the work by that team, we have placed what we call multi-factor access on all of our external access points. So we require multi-factor. That's what all of you use, commissioners, when you're coming into your Okta and you're getting those PIN numbers. But that's something you have and something you know, and that defeats a lot of these brute force attacks that come at us. And just making sure that all our external services are protected in that way as you're coming onto our interior network. So those are some of the basics. Rotating passwords. We really work hard to follow those government guidelines for compliance.
That sounds very good. Thanks. And then another question. I heard you mention MITNIC's Know Before program for IT security awareness. What's your kind of plan for cadence on training and phishing?
At a high level, it's really, right now we're working with HR and when the unions to put a program together and explain to everybody what it is. And then it's really some automated testing capabilities. You can actually deliberately put out opportunities for people to click and to learn from, and then to provide training, be both basic training and regular training, something we're partnering with our HR group on through LEAP that we've already started some with, but also targeted training if we have specific cases where testing is revealing some common clicking. And so that's what we found is successful organizations test regularly and then provide training follow-up and then test again. And then you really can minimize clicking on the wrong things.
So does that mean you're basically looking forward to a deployment sometime during this fiscal year, but you haven't started that planning yet?
We've already started the planning and work with the HR. So we're well ahead of the communication train, and we're actively getting ready to onboard that capability.
Great. Any other questions from committee members? Okay, thank you, Mike.
Thank you, everyone. It's a pleasure seeing everybody. Have a great afternoon.
Thanks. So committee members, if you would raise your hand if you want a break, I think we should just probably move through. We've got human resources coming up next, unless anybody, okay, I don't see anybody who needs a break. So let's just go ahead, excuse me, and move forward with human resources, please.
Yes.
All right, so we're just waiting for Jan to pull up our slides. Good afternoon, Chair Vlodman and Budget Committee members. My name is Alana Holmes, and I'm the Chief Human Resources Officer here at Lane County. I want to thank you for giving us this opportunity to discuss our HR department budget and some of the work we've been doing, as well as some of the things we're looking forward to in this next year. If you'll recall, last year, we came before you and asked for 2 FTE as we were looking to restructure how we did our work and supported the organization, best aligning with the strategic plan that had been implemented. So we have added an additional division, and the team of division managers are on this virtual meeting with us, as well as other staff who may support us as we go forward. When we look at the FY 2021 budget details on resources, our resource total is $2,916,000 approximately. So overall, we're funded by the general fund via indirect revenue from all Lane County departments. This year, however, we received a fund transfer from our benefits fund for 2 FTE that were approved as part of the supplemental budget in March. And we'll discuss a little bit more about that later in our presentation. When asked to reflect on potential COVID-19 impacts to our resources, at this time, we really were not able to identify any, although we do understand this is kind of a fluid and dynamic period of time. So we do know we'll be keeping an eye on any possibilities that can come up on the horizon. With respect to our expenditures, they total this upcoming fiscal year, they're anticipated total $3,236,000. And I guess for us, what's really changed in the last year since we talked with you is we've gone through our restructure, but really here it's the addition of those 2 FTE that I mentioned. It's to work on our lease program, and they'll be housed in the Workforce Wellness Solutions division. And the other areas, we're continuing to try to focus on how we can utilize technology to best meet our strategic and operational needs. And so, we've continued to look at Career Builder to help with our talent acquisition, and our NeoGov platform for applicant services has an opportunity for us to move and engage with them on onboarding so that we have a digital platform to help bring employees into our workforce. And then also moving into the world of data analytics, absolutely, training, understanding Tableau, and getting licenses. So those are some examples of how we're trying to utilize technology to continue moving forward. At this time, I'd like to turn it over to Ryan, who heads our newest division, Talent Management.
All right. Thanks, Alana, and thank you to this committee for the opportunity to speak with you all today. The Talent Management Division has a mission to give every Lane County employee the opportunity to thrive at work throughout the employee life cycle. We do this through 3 core functions, the first being talent acquisition, in which we focus on recruitment, selection, hiring, and onboarding a diverse and talented workforce. Next, our talent development function coordinates and administers training and development opportunities for that workforce, to include equity and diversity training and other training opportunities tied to employee engagement. Finally, through our talent resources function, we provide support to all our county employees through coaching, conflict resolution, administration of classification and compensation structures, ADA administration, and workforce planning. On our next slide, you will see a graphical representation of how all of those functions tie into our talent management lifecycle. Across all our core functions, we infuse best practices, embrace innovative solutions to improve operational efficiency, and ensure compliance with applicable laws, regulations, and collective bargaining agreements. Some of our division's key achievements this past year include a record high number of job applications received, 24% of which identified as a race other than white, which is an increase of 9% over the past 5 years. We've also streamlined the new employee orientation and onboarding process, moving to a primarily online and integrated process. And we furthered the leadership development programs by graduating our 3rd emerging leaders cohort, 2 additional leadership cohorts, and documenting over 25,000 hours of training in our learning management system, LEAP. Of note there, 94% of our end of course survey respondents say they would recommend the training that they just completed to a coworker. A couple of our focuses for the coming year will be continued implementation and oversight of employee engagement initiatives, and also a detailed review of our recruitment and selection processes to ensure we are utilizing best practices and promoting diversity, equity, inclusion. So with that, I will turn it over to Inglewood, our Labor Relations Manager.
Thank you, Ryan, and thank you, Chair and Budget Committee members for having us today. The mission of labor relations is promoting effective, fair, and respectful relationships between the county and its employee groups. We currently have 2 full-time employees in our division, myself and 1 program specialist. Some of you may remember that we reorganized last year with the addition of the Talent Management Division to allow labor relations to expand and explore more innovative approaches to collective bargaining and labor relations. I'm happy to report that this restructure has allowed us to do just that. We successfully negotiated the first contract here at Lane County through interest-based bargaining with our local 626 association. We're looking forward to expanding that with our other unions in the future, and other groups have already expressed interest in this solution-focused approach. We are also currently in training with AFSCME, our largest union, for the establishment of a joint labor management committee. This committee will allow us to solve things at the lowest level possible through a collaborative approach. Joint labor management trainings and negotiations with AFSCME nurses and their AFSCME general unit have currently been delayed due to COVID-19. However, we are eager to get started as soon as we can proceed safely. We've worked rapidly with county leadership to draft policy changes in response to the COVID-19 pandemic, while still providing services to departments on all labor relation and employment law related matters. We are looking at the temporary policies we have developed in response to the pandemic and how we can incorporate some of those temporary changes into the APM for future flexibility in our workforce. On the next slide, you will see we are responsible for bargaining, administering, and interpreting 8 collective bargaining agreements here at Lane County. We guide managers, supervisors, and employees through the bargaining unit language and our policies and procedures, which includes the disciplinary process and grievance process. In the next fiscal year, in conjunction with County Council and the Talent Management Division, we will continue to present frontline supervisor trainings on matters related to labor relations and employment law. We provide assistance and often answer EEOC complaints, bully complaints, lawsuits, and unfair labor practice complaints. We testify and assist County Council and many times act as the county's representative in arbitration hearings. Highlights for our division in this past year include, like I said, completion of the first interest-based bargaining with Local 626, successfully negotiated collective bargaining agreements with the Lane County Police Officers Association, the Administrative Professionals Association of Lane County, Inc., and the American Federation of State, County, and Municipal Employees AFSCME Physicians Unit. This is a brand new contract for the physicians. We presented frontline supervisor trainings with County Council and the Talent Management Division, including implementation of recommendations from the Employee Engagement Team. We also presented labor relations trainings to the Emerging Leaders Program and our Leadership Certification Program. Our division is responsible for managing unemployment claims. With the state experiencing record numbers of unemployment claims due to the pandemic, we have been able to keep up with employment department requests for information and often providing responses well before the deadline. In the coming year, we will continue to work with other divisions and departments in the county on supporting strategic initiatives that impact bargaining. Next, Mary Miller, our Workforce Wellness Solutions Manager, will tell you more about that division.
Thank you, Inga. Budget Chair and committee members, we are serious about Workforce Wellness Solutions, and here are some fiscal year 19-20 highlights. Workforce Health Analytics and Benchmarking revealed a high incidence of claims for musculoskeletal and behavioral health. Our solution was to develop targeted interventions. So partially part of the plan is putting a physical therapist in the Live Well Center, which we hope to do later this year. Under behavioral health, we've expanded mindfulness practice for our public safety staff in order to prevent burnout, and we've also expanded the hours of the behavioral health counselor in the Live Well Center. Our deferred comp fees were increasing with TIAA, So our solution was to reduce the deferred comp participants' fees by 30% by transitioning to ICMARC effective in July 1. Our county-sponsored Medicare supplement costs were increasing, so our solution was to add a zero premium option. Just true. Okay, annual open enrollment and new employee orientation are mission critical, but labor-intensive processes. We were able to finalize open enrollment in record time, and we streamlined the benefits section of new employee orientation, cutting our staff time by 50%. The Family First Coronavirus Response Act expanded employee paid leave programs and employees' eligibility effective April 1st. The Oregon Family and Medical Leave Insurance Program is also coming. Our solution was to adapt the current leaves process, and we have already processed 265 emergency paid sick leave and emergency family medical and leave expansion claims. We're also restoring 2 FTEs in 2020 to plan and implement the new program that is coming under the Oregon Family Medical Leave Insurance Program. On our next slide, you'll see that by collaborating with our trusted partners, we made great strides in fiscal year 1920. Enrollment in the high deductible health plan increased by 12% for a projected annual savings of $225,000. This was due to our online benefits advisor, Alex, and the addition of a health reimbursement arrangement option, also known as an HRA VIVA. The LiveWell Center performed health risk assessments for 63% of employees. For our high-risk employees, 83% are in coaching through the LiveWell Center, and 53% of them are improving. Our 12-month estimated savings from the LiveWell Center is $1.9 million. Also, the behavioral health counselor engagement has increased over 250% in 12 months. Participation in countywide safety committees and activities reduce the risk of virus spread. We also attended national training for surviving an active shooter, known as ALICE, to keep our training updated. Our utilization through our Inova EAP is at 9.76%, which compares to their benchmark of 5.83%, showing that our employees are using this benefit and seeking better mental health. We're still the #3 healthiest employer in Oregon. That's our 3rd year. And we're still in the top 100 healthiest workplaces in America. It's been a good year. I'm pleased now to hand it back to Alana Holmes, our Chief Human Resources Officer.
Thank you, Mary. All right, so now I'll talk a little bit about the administrative arm of our department. And as you can imagine, we have quite a variety and volume of work in our area, so it's always interesting. We're responsible for the overall strategic direction and direction of the department, as well as providing support to all of the divisions. We work closely in partnership with Lane County departments to help meet their business and strategic needs. A few other items that our section is responsible for is our biannual work on the elected officials comp board. We work with a group of volunteers to set elected officials salaries for the next 2 years. We're also the legislative liaison for a large body of work. And then also new this year is starting to do work on data analytics. So our next slide is basically a reflection of our strategic planning work, our policy initiatives, and our equity and inclusion work, which is really important to our whole department. The mark in the center of the slide reflects who we are as a department, supporting our people, our colleagues with passion and purpose. Some of the highlights of FY19 and 20, hard to pick, but there are several up on the slide that you can see for yourself. But I do want to include a nod to the rapid deployment of a telework toolkit for all employees and managers and supervisors that we were responsible for creating and getting out there. You know, when we started trying to move from a physical workforce where we all were together to, you know, being responsive to COVID-19. We also created an HR COVID-19 related hotline that was open to all employees and supervisors Monday through Friday, 8 to 5. We had the lead role on the recruitment and retention audit response, as well as a redesign of the evaluation process for employees that report to the board. So when we think about COVID-19 workforce impacts moving forward, we really have a list here that you've probably heard from several other departments, but we do think that many of these will continue to be utilized as we move forward in our future work. So some of those will be, how do we blend our physical work locations, and how does telework, what have we learned about telework, and how does that blend into our future work? How do we continue with policy development for the landscape that's coming up? Those are a few examples. And then of course, as we talk about future challenges and opportunities, that lens around COVID-19 will continue to play, I think, a big role. There's expanding, rapidly changing components to our workforce and to our services as we are in this mid-COVID-19 scenario and as we move forward from there. So we will need to continue to be very flexible and agile in our work to be able to support all employees and the departments with what's to come in this unique time. As always, we're very big supporters of the Lane County Strategic Plan and have a few areas that we are very connected to. Of course, as HR, we are all about our people and partnerships. Some of the work that we have been doing and will continue to do focus in the areas of enhancing employee engagement and resilience. This year, we're able to implement a Lane County employee code of professional conduct and also implemented an infants in the workplace policy. So in closing, it is my hope that this presentation has helped you to better understand our reorganization and our vision for moving forward with the work we do to support our workforce and community. And at this time, I welcome any questions. Thank you.
Questions from committee members? Larry, you have your hand up. Go ahead, please.
Yeah, a couple of questions on workforce wellness solutions. I noticed personal services are up 236,000, but the FTEs are the same from last year.
Mary, I would turn those questions to you if you have an answer for those right now.
Actually, could we go back to the slide for Workforce Wellness Solutions FTE count? Yeah, I don't recall that 9.5 being the same number that was on the presentation last year. We did add 2 positions, and those positions are being funded through a transfer from the benefits fund. And both those positions will be working on the leaves programs and also on the Oregon paid family and medical leave insurance. So that's where why there's additional funding.
And Mary, I think it's partially funding what's the remainder of this fiscal year, and then reflecting as we move forward into next fiscal year for, having those 2 FTE on an ongoing basis. And I'm looking to Christine to correct me if I've not captured that correctly.
Right, that is correct. So as mentioned, FTE were added in the supplemental this year. So the FTE will appear the same year to year, but they were only funded for a few months in the current year. And then next year's budget includes 12 months of funding for the salaries. So that's the difference.
Okay.
Anything else, Larry?
No, I'm good.
Very good. Mr. Hazen.
Okay, quick question for Mary, and then a quick question and a comment for Jan. Mary, what's the reportable OSHA reportable rate you mentioned on ergonomic injuries?
I don't have that number right now, but I can certainly get it and provide that to you.
Okay. Question for, comment for Jan, first of all. Really important work that you're doing. I sort of come out of a professional services consulting company management background, and I look at everybody who works for the county as you call it, talent, and you know, really essential to the outcomes that we all depend upon as citizens. So really, you know, commend the work that you do and the commitment you have to the excellence of this function within the county government. Having said that, I'd be interested either now or in follow-up to today's presentation, if money were no object, and of course it is, but if money were no object, what additional things would you do to attract the best and brightest people in Lane County to work for Lane County government? Attract and retain.
That's a great question. And I'm sure I should probably do a follow-up because I probably won't capture everything now. But a couple of things that come to mind is finding a better way to help candidates understand the richness of the entire total comp package that we have. Sometimes people aren't understanding of all that entails, and I think we have some opportunities to look at how we could package that up better. And there are some other things that I think we could do, but if it's okay with you, I'd like to incorporate those into a response and get them to Christine to disseminate those back out to you.
Sure, that'd be great. And I'd love to hear how our county benchmarks total compensation against other counties, because I agree, total compensation is the key.
Thank you, and I appreciate that. Looking forward to getting you those responses.
Other questions? Commissioner Bosevich.
Thank you. And Chris, I appreciate you mentioning total compensation. It's something that's been an issue over the years that's difficult to explain to people, that our total compensation package is quite generous and but difficult to enumerate. Everything from TM to PERS to our health insurance are difficult to do comparisons on. So what a lot of people want to do is just compare the straight salary portion of our compensation with other comparables and claim that we're underpaying our staff at times. So I'm glad you at least mentioned that, because that's been an issue for a long time. I just want to spend a minute to thank Alana and the folks in HR. When I came into being a commissioner back in 2011, there were things that were not happening correctly in our employee development, which included not even having a systemic training program for managers and supervisors. And one of the things that our HR and our county council's department did was establish the Managing Within the Law series and a constant training for managers and supervisors, which has greatly reduced my time in executive sessions resolving employee issues at the board level. They seem to be resolving at lower and lower levels because the managers and supervisors are understanding, got a question, come to HR and county council early, don't wait. And it really helps out a lot. The other things that just have been amazing is the employee development work that HR has done with their leadership programs and all over the years. And in particular, the work they've done in diversity, hiring and training and moving people into management over the years. I think some of the new numbers, over 20% identifying as non-white, it basically is pretty amazing applicant-wise this last year. So I just want to say, such a big change in the almost 10 years I've been a commissioner, what's happened with our HR department. And it's made a huge change, I think, in our employee development and our employee morale, that we've made some of these changes. And it sure has made our time as commissioners able to focus on strategic plans. But it gets back, though, to that strategic plan. Several years back, we amended it to have something specific to our people.
as being one of our strategic goals. So just want to say congratulations, Alana, to you and your staff for the great work you're doing.
Thank you so much, Commissioner Bozovich, for your kind words. And I really have to acknowledge the great team that I have in HR and how fortunate I am to have a group of highly talented, committed, professional individuals who really do have such a passion to serve the organization and community. And certainly, I would be remiss to not give a nod to Erin Rollins, who is our talent development strategist. And I don't know how she does everything she does. She's amazing. And then certainly there are joint efforts for a lot of our other training initiatives that you've discussed. And we are always looking for opportunities to help move our workforce culture forward. And I just can't be more pleased with the team that I have in the HR department. So thank you for your words.
Herb. Yes, Commissioner Sorensen, please.
Thank you. Thank you for letting me know this is a decent way to hail your attention. I really appreciate it. I just wanted to make a couple of remarks about the significance of the training that has been taking place over the last few years. When I first became a commissioner, we had employee lawsuits to the point where every week we had an executive session to talk about the employee lawsuit of the week in executive session. And many of those problems were related to training. And so our county administrator, our county council, our personnel director, people with various titles like that, have really been very proactive in getting this training. And I just wanted to highlight that that's been one of the really big changes that I've observed in my 2 decades on this budget committee. Thank you.
Thank you so much, Commissioner Sorensen, for recognizing the importance of training and development for employees. Really appreciate that.
Commissioner Burney.
The more I hear from commissioners who have been commissioners for quite a while, the happier I am that I only just got here. As much as I hate to acknowledge when Chris Hazen asks a good question, Alana, when you do get back to him, I would be very curious with your answer as well. Thank you.
Absolutely, and look forward to providing those and answering any follow-up questions.
Any other questions from the committee? Commissioner Buck, do you have anything? Oh, sorry, I thought I saw your hand there. Okay, thank you very much, Ms. Holmes, and the rest of you from Human Resources really appreciate it.
Thank you again for the time today. We really appreciate it.
Okay, that brings us to committee business. Does anything from the committee members to bring up in this section? Seeing none, Christine, anything from budget staff?
No, just a reminder of the meeting starting at 1:30 tomorrow, and that we'll have additional information for you, so watching your email tomorrow morning.
Very good. Thank you. Okay, seeing nothing else, we will adjourn today's budget committee meeting. We'll see you tomorrow at 1:30. Thank you all.